friends, how are you all? I hope you are doing good and I'm good. This is Dr. Monica, general surgeon. I know it's been a while I haven't made any videos, so without any delay, let's discuss something about vitamin B12. Vitamin B12 is also known as cobalamin. It is a water soluble vitamin. It plays a steering role in keeping our body healthy and balanced. Yet surprisingly, many people don't get enough of it, especially in a vegetarians or who follow strictly vegan diets and in a elderly adults. Coming to the functions of the vitamin B12, it is responsible for the nerve function, thereby helps with the healthy brain, and it is responsible for the production of the DNA and RNA synthesis, and it is also responsible for the formation of the red blood cells. Coming to the causes of deficiency. So basically you are at risk of deficiency if you don't get enough vitamin B12 from your diet, or if you don't absorb enough vitamin B12 from the food that you eat. Vitamin B12 deficiency is so common in India. So the people who are at risk of this deficiency are elderly adults and who had surgery that removes the part of the bowel that is responsible for the absorption of vitamin B12, and the people who are on drug metformin for diabetes mellitus, as I already said, those who are on strict vegan diet, and people taking long-term antacid drugs for the heartburns. The symptoms of vitamin B12 deficiency. Most of the patients present to us with the complaints of pale or slightly tinged yellowish discoloration of the skin. This is due to the vitamin B12 is responsible for the RBC production. If the deficiency occurs, there will be a fewer red blood cells circulating in our body, and therefore the skin appears pale in color. One of the other common symptoms the patient present to us is fatigue and generalized weakness. This is because the body doesn't make enough RBC that is responsible for the transport of oxygen to the cells, thereby resulting in fatigue or generalized weakness. And the patient also present to us with the complaints of glossitis, that is the inflammation of the tongue, or mouth ulcers. Long-term B12 deficiency had an impact on the nerve damage, thereby presenting with the complaints of paresthesia or pin and needle sensations. Due to the involvement of the optic nerve, the patient may complain of disturbed vision or a blurred vision. Coming to the signs of the vitamin B12 deficiency, one of the common signs you can see is pale eyes or yellowish discoloration of the sclera.